of Psychology, American College, Madurai, with different associate partners. Yellowpon Counseling and Wellness and Tamil Nadu Counselors and Psychotherapists Association. Today is 2334th section. Today's topic is scope of homeopathy in integrative addiction care to address the root cause. Our resource person is Dr. Rekha, Karnam, Srinivasan. I welcome you, ma'am. I welcome other participants. I like to share about our resource person, Dr. Rekha Karnam Srinivasan. She is a mental health professional, homeopathy consultant, and he is closely associated with the research related to the cancer and the root cause. I welcome you, ma'am. The floor is yours.
Yeah. Hello. Good evening. Hope I am audible.
Yes, ma'am.
Thank you so much, ma'am. Thank you so much for a wonderful introduction. And today I am here again to talk about psychology and the homeopathy integrative care, especially in cases of addiction. First, I want to thank American College of Psychology for giving me this wonderful opportunity. It has been a great thing, learning for me as well, as I am digging a lot to know my cases or where psychology and homeopathy can be integrated perfectly. So here I am about talking about scope of homeopathy in integrative addiction care to address the root cause. So when it comes to addiction, what is the definition? It is addiction is defined as a chronic relapsing disorder characterized by compulsive drug seeking and use of uh, substance which has adverse effects. So it is a brain disorder. So what is the brain concept, brain disease concept? Addiction is a chronic relapsing brain disease that leads to medical, psychological and social complications. So American Society of Addiction Medicine defines it as treatable chronic medical disease involving complex interactions among brain circuits, genetics, the environment and an individual life experiences. People with addiction use substances or engage in behaviors that become compulsive and often continue despite harmful circumstances. So this is a brain disorder and not a or not just a lack of character or whatever. So usually what people think. Yeah. So what is the inside of the brain of an addict? What is there? So inside the brain, there is substance is consumed. Dopamine floods the brain, triggering the reward system. Hippocampus locks the memory of pleasure. So this is very important. Locking the memory of pleasure. Dopamine does not increase or decrease the pleasure complex, but it only helps in locking the memory of pleasure. So that leads to again and again craving for that old memory which was very pleasant. So they think by consuming the same substance they will get the same memory of pleasure. So that's why their prefrontal cortex, which loses control over logical decisions. So memory and emotions drive relentless cravings, overpowering reason. And nucleus accumbens craves repetition of the substance or habit. And amygdala links the two triggers like people, places, or situations. So this is the pathophysiology of brain addictions. That is brain in addiction. So these are all the types of addiction: nicotine, game addiction, drug addiction, and alcohol addiction. So what are the types? It is based on the addictions to substances and behavioral addictions. And when it comes to addictions, behavioral addictions are little comparatively better prognosis. At the same time, recurrence of behavioral addictions is far higher. But addiction to substances is very damaging to the overall person's health, and it is so damaging. It is not that easy to remove the bad effects of addiction. Even cannabis is said to have very adverse effects, even consumed even once in a lifetime. I have read that once in a lifetime. So it is so damaging. And as we know, tobacco, alcohol, and all these things, it is a common knowledge. I'm not going to repeat so that to uh, save the time. And addictions in behavior includes sex addiction, gambling, food, and internet addiction. So basically, all the addictions comes to one point, and that is what my point today I am talking about. What is that one point? Dopamine craving. We can say it's an informal thing. Okay, dopamine craving means you want that pleasurable memory to come and flood your brain again and again. So it is in a way dopamine craving. So there is a brain reward circuit, and we have spoken about that now. So I'm not going into detail about that. What is a brain addiction? Brain, I have spoken about that. So the onset of addiction in the normal brain is addiction begins with initial exposure to the substance or behavior. It gives some rewards, and then upon exposure, substances or behaviors activate the brain's reward pathway. So they want that again and again. Reinforcement learning. Through reinforcement, the brain links substance or behavior with pleasure, strengthening the neural connection and promoting the future repetition. And it is the most important thing for the relapses, because even though they have come out of the addiction, that reinforcement, that feeling, maybe I will get better this time, I will have more pleasure this time, or for a small thing, like in movies they show, no, the hero or someone, he has some small problem, and again he will think, oh, okay, I will go and have alcohol, it will be better. So that is the reinforcement. Even though he has come out of that addiction stage, he may go and have it again and again for some reason. So this is very, very important. And then neuroadaptation. So nerves have adapted to the exposure, and desensitization and training. Over the time, it is not helping them anyway. So they have to consume more and more to have the same amount of pleasure, but pleasure is not there. Altered brain circuitry, and then loss of control. There is no loss. That is the uh, usually addiction start with use, then it goes to abuse, and it goes to dependence. So in the stage of dependence, their brain circuitry is altered, there is loss of control, and there is a compulsive behavior. Though they want to come out of it at certain point of time, they are unable to do because of the there is a changes in the brain itself and its circuit. So, what are the objectives regarding to this with homeopathy? So, objective is addiction is rooted in genetic, neurological, and social environmental exposure. Recognition of these and levels of health of the patient can help treatment planning. Why I am bringing up the levels of health of the patient means, uh, levels of health, if we know, see, if the person has a very good level of health, say there is no family history, there is no past history of any major illnesses. The boy or the person has a very great health till now, and now he has addicted. So with some help, he can come out of it, and he may not be having relapses also. So it is a very great thing if you know the levels of health. But if we have a child abuse, trauma, and also very debilitating illnesses before, or in cases of neurologically challenging cases like head injury, something like that. So past history matters a lot, and family history also matters a lot, and it helps in treatment planning. So we can give utmost help to the patient. And mental health support systems can be initiated by talking to the patients, concerned family members, or educatable well-wishers. See, usually the person who is addicted, they never approach for help. They'll be in the denial mode always. Their parents or their family, friends, or a spouse, alone will be sending their person for care. So when we make certain things very clear, see, they have a brain related problem. It is not just their lack of discipline. So when we uh, educate their well-wishers and family members, outcomes will be very, very good, and also it will be sustaining. So those with conditions like anxiety, depression, and ADHD exacerbate substance use when patients are tormented by people's actions and interactions. So if their loved ones are taunting always, or the people around them, they are not understanding them, definitely they will have more adverse effects. So when we have a support system, mental health support system, we can help them better. So how can we explain these to common people? What is addiction? So people will usually think the person is doing something wrong willfully. So but that is true in very, very early stages. So he is entering into that willfully. Okay, he wants to do that. He has some excuses like I failed in the exam. My girlfriend ditched me, or boyfriend ditched me, something. Okay, so initially it was willful, but that entering is also can be controlled by healthy people. So not everyone who has been ditched by their loved ones get into abuse or dependence on alcohol or any substance, isn't it? So it's not that rare that people are getting being betrayed, isn't it? So uh, but after some point they have no control over it, that we have to make them understand. So anything which cannot be grown out of. So if a child of 3 is having phone and he's angry and he's uh, biting his mother or father, so he can't grow out of it by 10 years. It will be still worse maybe. Or even if you control and you keep him in check, in adulthood, definitely he may have lots of issues. So you have to make them understand you can't grow out of it. You can't got over it. So 3 days fully, in one movie, he says his father gave him to smoke for 1 month, and he got so much fed up and he left it. It is not that. It is not that. It's not possible. So it can't be got over. That can be certain few months here, they may postpone it, but no, they will relapses are very common. So pushed willfully, victim has no control over it, cannot be controlled by the willpower or without medical help. So this we have to tell the people around them, and it is always on their minds and stopping their daily activities, or at least hindering their personal growth, creativity, work progress, and personal life at stake. So no energy for things important to them or the person. A compulsive chronic physiological, please note it, physiological or psychological need for a habit forming substance, behavior or activity having harmful physical, psychological or social effects, and typically causing injury. So uh, withdrawal symptoms are anxiety, irritability, tremor, or nausea. So, what are environmental factors? This is a very, very important thing, and especially nowadays, it is very high. And even we saw that I was part of that de-addiction, how to bring about in the college students. It was a very well rounded course on that, and it was very helpful. I attended that course from uh, American College of Psychology recently. So, what are the environment factors used by parents? Loneliness, desperation, poverty, easy access to drug. It is a very, very important thing. Peer pressure, and that is the highest thing. These two are determining the youngsters who are getting into so many habits. Even with healthy kids are also getting into that. and family problems, marital problems, unemployment problem, physical abuse. So most of the things I have already spoken about. Hard working physical or menial job. So these people can't sleep without having alcohol. So we'll see how homeopathy can help to some extent in them also. And poor socio-economic status, lack of recreational activities, cultural and social habits, social media advertisements. So these are all pushing the youngsters into substance abuse. And what are the environmental factors? It is a case. Shall I discuss now, or we'll keep cases later? Uh, okay, I will talk about this later. Yeah. Uh, so, WHO has said urging governments to strengthen regulation of digital platforms and to introduce age-appropriate safeguards for end users. So it has become very rampant that in a way we are pushing the kids into uh, poor dependency, and then we are blaming they are using it round the clock, isn't it? During COVID, everything happened on phone, and now they are not coming out of it. So it's a very alarming thing. And here also, I have a case of 3-year-old boy who was very restless and needs something either jumping or mobile phone to scroll. So if parents shout or punish, he gets angry and throws tantrums. There was a speech delay, and I treated him, and he got cold, cough, and physical symptoms he got, and then he had also fever and all. And then after treatment, almost all of his problems settled. His speech improved in few months to near normal with speech therapy as well. And he don't want the phone now. He gives to his mother and he wants to play outside with the peers. Previously, he was not having friends actually. He was not very easy moving. He was a shy boy. Now he is a normal kid, normal school, and everything is normal. He is getting good grades. So he is not interested in phones now. So this is one way how homeopathy can help. So I wanted to tell through a case so that it will be easier to understand. So these are all the uh, alcohol poisoning. So how teens get to know about the substances through the streaming on videos, watching TV, movies, and browsing the internet, but especially peer pressure. So guess who had told that the desire for alcohol for a drink is a kind of mental perversion beyond the rational resources of morals and medicine. So this is the way uh, doctors understood alcoholism in 1889, and this word was by Dr. Pierre Galavardin, a homeopath from France, who was a very propounder of alcoholism treatment with homeopathy. So even though we treat every person individually, so whatever comes in between we treat, isn't it? But specifically we didn't knew that alcoholism a way of that can be treated with homeopathy. So the symptoms coming out of uh, abuse of alcohol can be treated with homeopathy. So that was propounded by Dr. Pierre Galavardin, and he had told this in 1889 itself. So such a wonderful thing, right? People, our ancestors are so very smarter than us. We can say. And what is the state of drug cases in states in India? So it is so alarming, right? So it can be still more than this because it is only recorded, isn't it? And then as a clinician, what we hope homeopaths can do in this. So that is the question today we are talking about. So in alcohol addiction, there is binge intoxication, and then uh, uh, first preoccupation and anticipation, binge intoxication, and then withdrawal or negative effect, and again preoccupation, anticipation. So this is a cycle, ongoing cycle. So it can be how it can be broken. That how we can break the cycle of that preoccupation and uh, addiction thing. This is a case of alcohol dependence, age 57. He was having a very high profile job. He was working with CM at that point of time. So you can understand the gravity of his problem. So there was problem at home as well with his mother and wife and brothers issues, loans and so many things. So he was drawn, like he is into sucked into the from use abuse to he was sucked into the next level. So it was before treatment his alcohol dependence was 15. Uh, it is a actually little moderate to severe side. And then uh, after homeopathic treatment, his alcohol dependence came to 7. That is at the level, it is a safe side. Even now, has a control over his this thing. And whenever he is having trouble in sleeping, something like that, he will only having alcohol. So even he gets treatment for his gastritis and other things, but it's in the safer zone. He is in the use stage. So another case, this is a very interesting thing because I treated him in 2021 where he was reported by his wife where cage score was 2. CAGE cage score was 2, which means significant alcohol misuse. And then now he had come for some other reason, and I got his liver function and other things got tested, and everything was surprisingly in the liver grade 2 it is, but still okay. It is not that much damage after seeing 5 years. Okay, and then his score was now 5. That is a very good thing actually, because it is not a in a bad kind. He can control his number of things. And then after treating, that is on 25/9/2020, sorry, now 26, sorry, the date mistake. I treated in 2026, 25/9/2026, sorry, I treated in July. And now he came back and told me he can stop the alcohol usage. He was using for sleeping. He was unable to sleep. That's why 4 days in a week he was using, and now he has stopped completely. I was really shocked. I asked him, if you want some, no, I don't want anything. I'm having very good sleep. I'm feeling happy now. Even I have issues and stress. I don't want to drink alcohol. I can manage it. So that is the point here. So we are addressing, homeopaths are addressing the uh, person as an individual. So we are improving the person's ability to overcome the problem. And by that, we are helping the psychologist and all the other therapists and all other stakeholders in help coming out of one major thing that is related to brain. Other things have to be taken care by the all other stakeholders. So only homeopathy can't bring everyone out of their problems, but definitely homeopathy has a very good role, I can say. And these are all the common remedies we use, which will be helpful, which also helps reducing the liver damage. If time, is it okay? I can speak another 10-15 minutes, I think. Yes.
I think it's
I will make it.
7 minutes, 8 minutes more.
Oh, okay. 5:30 only.
Yeah,
Okay.
5:30, 5:40 is going to close.
Okay. So, when we are talking about brain thing, we were seeing that ADHD brain. So, what does we mean by ADHD brain? ADHD brain is also typically, it is a neurodivergent. That is, they have issues in their brain as such. It is not just a habit or it is not a problem with their behavior or with their willpower or laziness. Nothing like that. So they are spiraling into intense emotions after rejection or perceived rejection. So they are not doing it purposefully. Constantly over apologizing for small mistakes and trying to please everyone at the expense of their own needs and feeling crushed by criticism, even if it is gentle. So this is ADHD. So there is anxiety, depression, personality disorder. So these things trigger them. They push them towards having something which will make them feel pleasurable, happy. So ADHD tend to be friends with anxiety, depression, and autism. It also associated with conditions that can cause chronic pain, which can affect your executive function, the ability to plan and accomplish tasks. So that's why ADHD brain means they will have lots of issues within themselves, which leads them to do abuse. It could be behavioral or substance. So they have weak. So I will not go into detail about this. So women who self-harm and experience complex mental health difficulties are frequently diagnosed with borderline personality disorder, isn't it? But also known as emotionally unstable personality disorder. Emerging research suggests that self-harm may offer, pardon?
అవునా వచ్చారా
Ma'am, can you show
Self-harm,
the previous slide once more?
okay. This one or previous one?
No, ma'am, this one only. Thank you, thank you.
Yeah. Yeah, women who self-harm and experience complex mental health difficulties. Yeah, we were talking about this. Emerging research suggests that self-harm may often be better explained through the lens of autism, and that greater consideration should be given to clients' motivations for self-harm. Is it self-harm? So, how time alone is experienced may also be a differentiating factor. As I already told about the ADHD, right? They have problem with moving with people, and they experience each and every normal conversations as a telling something bad about it, isn't it? So that is the root cause. It is not that people are being rude or something. And the objective was so this was why I am talking about this. I want to talk about a case in related this. One I had one case. She was in second year. She was studying in second year then in college and in a hostel. And she was addicted to her roommate and classmate friend. Okay, so much so that she will be falling down with a high fever. Still, if her friends ask, she will go to a shop and bring tea for her. See, literally, she is like a slave to that girl. Okay, that girl was also enjoying. I can't say that she was a very good girl, but still she has helped her in studies and all other things. So that is favors. So it is like a combination of a narcissist and that girl being a. I would I had diagnosed as a BPD then, but I understand she is autism ADHD later. So that girl already had attempted twice to die by cutting her wrist. So you can understand the delicateness of that case. And when she narrated, it was like a blank. It's like her face was like a board. I couldn't understand whether she is telling the truth or what. She is talking about some cinema stories. She is telling such a bad things had happened to her, and I felt so sorry for her. I treated her. She was very good. After 3 or 4 years, she completed her studies. Initially, she was not interested, but then with my counseling and all, she was also on psychiatry dosage. And I spoke to her mother, and her mother stayed with her, and she completed her course. And then she was working also. Again, she went into someone betrayed her, and it was very bad again. So my heart goes for that girl. At third time, again she ended up in such a thing in her marriage also, abusive marriage. But this time, when I wanted to treat her, she told me, "No, ma'am, I have a job. I can survive. I don't want this man. I will come out of this marriage." I was so happy for that because it's not about homeopathy or treatment or whatever. It is about the transformation of her, empowered. Again, she is empowered. So that was very happy for me. So this is the way it happens in ADHD, where they are people pleasers and they are addicted to people. So that is the main problem with them, addicted to people. So these are all things I'm talking with cases so that it will be easier to understand. But here you can understand that homeopathy has a significant role in helping her. And about substance abuse and mental health services. Cannabinoids such as delta-9 tetrahydrocannabinol, the primary psychoactive component of marijuana, target the brain's internal or endogenous cannabinoid system. This also contributes to reward by affecting the function of dopamine neurons and the release of dopamine in the nucleus accumbens. So, why cannabis is so deeply engraved? Because it directly hits the target. It knows where to hit the target. So, what are the withdrawal symptoms? Anger, aggression, irritability, anxiety, nervousness, restlessness. So, these are all. But the thing is, we have to move with corroborative evidence. A boy is having, he denies he does not have any cannabis exposure, or he is not taking, or he has taken only one. But he needs lots of money. Okay, not that amount of money which is needed for drug. He needs more than normal amount of money. He is not ready to do anything what anyone else suggests. He is of his own. Okay, he goes out of sight for a few hours in a day or in a week, something like that. So these are all corroborative evidence. But the thing is, boys who have cannabis thing, no, they never confess that they have addiction, and that is one biggest problem for us. Because if we know the problem, then only we can treat them well. But anyway, homeopathy can be little helpful because we treat the individual with based on the symptoms. So maybe they may open up, maybe they may